State telling you about why it may not renew the clinic's license?
Well, this is a real public health crisis that's happening right now, because we could face a situation where by the end of the week, more than 1.1 million women in Missouri will have abortion inaccessible in their own state. So abortion remains legal, but if it's inaccessible, then for all intents and purposes, women just are not able to access essential health care.
What are you expecting at the hearing today?
Well, we hope that the court will see exactly what's happening, which is that over the last 10 years, the state of Missouri has imposed regulation upon regulation that has no basis in medicine. We've complied with all of them because we want to keep our health center open. These are things like making our hallways extra wide, forcing women to wait 72 hours, even having unnecessary invasive pelvic exams.
Isn't that dangerous?
It's bad for health care. It's also traumatizing for women, especially women who've suffered sexual assault and rape. And we've done this because we want to keep on providing health care. But now the state is threatening to prosecute our doctors. The bill that the governor just signed would put doctors up to 15 years in prison for providing medical care. And that's just a terrifying reality for women and doctors.
What do you think, Dr. Nguyen, that people don't understand how serious this is?
People need to understand that this is not a drill. It's not hypothetical. Missouri could become the first state in nearly 50 years to have no abortion care in the entire state. And I want people to know that Planned Parenthood will always fight for women. We will always be here. We'll fight in the courts, we'll fight in the legislatures, and we need everyone's support to fight these extreme bans that are happening around the country.
And Planned Parenthood is more than just abortions. I think people need to understand that, too.
We at Planned Parenthood are proud to provide the full spectrum of reproductive health care, cancer screenings, affordable birth control, STI, HIV tests, and yes, safe, legal abortion care, because that's what it is. It's health care. And we at Planned Parenthood do more to prevent unintended pregnancies than any other organization.
You know, we've tried to reach out to the state of Missouri and the Department of Health there. We haven't heard back. Don't they have a right under the law to impose these restrictions?
Well, what they are doing is to weaponize the inspection process and to politicize it. I'm a former health commissioner.
Do you think it's not in good faith?
Not at all. And in fact, they have said that their intention, the state of Missouri has said, and anti-women's health politicians have said that all these regulations have only one purpose, which is to shut down the ability of health centers to provide safe, legal abortions, which is not going to stop abortion, but it will stop safe, legal abortions, and the cost will be women's lives.
You were at the clinic in Missouri yesterday.
That's right.
What were the doctors there telling you?
Well, I met with the staff, the doctors and nurses and other clinicians there, and our staff are saying that they've seen this coming for years because they have been on the front lines of having all these requirements imposed on them that they've had to meet. And now this is coming. This is a warning to everyone in the country that this is not a drill.
I've heard you say that this is personal for you, this particular case. How so?
I was a medical student at Washington University in St. Louis. I volunteered at that health center, and I've seen for myself the women who already travel hundreds of miles to access essential health care. And now to see that health care literally being taken away, that will endanger women's lives, in particular women with low income, women who have to travel from rural areas. And this is what's happening around the country. This is the real impact of these terrible laws that are being passed.
Dr. Lena Nguyen, thank you for joining us. We have to go, but I do want to point out donations, they are going up. True?
They are, and I hope that people will keep on supporting Planned Parenthood and other organizations that provide essential health care.
As you say, it's not a drill. Thank you very much. We appreciate it. Many people with seasonal allergies find there is no relief at night ahead.